Over 14,000 Department of Veterans Affairs employees in healthcare positions in the Department of Veterans Affairs. What they did is they applied to leave their jobs through several government wide separation incentives, according to data from an internal dashboard obtained by the Federal News Network. Okay. Last Friday, May 16th, was the VA's deadline to apply for the deferred resignation program. Eligible employees, once approved, will be able to go on paid administrative leave through the end of the fiscal year. A VA spokesman told Federal News Network last week that very few of these Veterans Health Administration employees qualify for the deferred resignation program, which is known also as DRP or early retirement. But some of these VAH employees say they plan on leaving federal service even if they don't qualify for these separation incentives. More than 1,700 VA nurses, nearly 900 advanced medical support assistants, and more than 200 VA physicians have applied for the agency's deferred resignation program, signed up for early retirement, or voluntarily retired from the agency. Frontline VAH employees who provide healthcare to veterans are mostly exempt from the DRP offer, but the VA's internal dashboard shows that nearly 100 VA police officers, 200 contract specialists, and hundreds of human resources officials also applied for separation incentives. What they said is DRP or no DRP, I'm done. And that's concerning for us veterans. I went to an appointment just a few weeks ago. I changed primary care doctors and I went to go talk to my current new primary care doctor. I waited a while to get my appointment. Then, when I finally got my appointment, there were several issues that I had to catch up on. Well, I didn't even have enough time, nor was I given enough time to explain all the issues that I had going on. I had to hurry. Why? Because the caseload is becoming a lot higher for our healthcare providers, right? And there's one of them versus a thousand of us, right? So we're still not getting the care. I mean, I shouldn't have to feel rushed to go through and to get the health care that I raised my right hand for, and to be able to talk about my issues thoroughly without feeling rushed, without feeling like a bother or anything like that. And that is a concern. People are saying I'm done. And the reason why they're done is because we're cutting that workforce, okay? And people are getting burnt out. Somebody's still got to do the work. The claims are still rolling in. People still have and still need health care, right? Us veterans who serve still need health care. So somebody still needs to do that. That's the last thing we want are people going away, and especially people in permanent and prominent roles, such as police officers, such as healthcare workers, dentists, doctors, medical professionals. That's not what we want. They're saying they're going to take things and put it on the community network system, but guess what that's going to do? It's going to be a ripple effect to back, to backing up the system is what it's going to be. So a veterans crisis line responder, right? Here's what they said. They started the job earlier this year. They said he applied for the deferred resignation program and that he plans on leaving the VA, even if the department doesn't approve his application. This is what he said, and it's so true, right? This wasn't what I thought it was going to be. And so, DRP or no DRP, I'm done, the employee told Federal News Network. The VCL responder, a veteran who's held several VA jobs for nearly 2 decades, said he spent the last 2 years applying for VCL jobs. But once he started the job, he said it didn't offer enough work life balance. He said he was assigned to work shifts from 3 a.m. to 11:30 a.m. Pacific time. If I were on the East Coast, he was saying that would be an ideal shift because you're working early morning and you get off early, but it's not feasible for me to do that. The VCL employee said he asked the supervisors about changing schedules and applied for reasonable accommodation, but said those efforts were unsuccessful. The reality is this. The reality was this. They weren't able to help that veteran, that guy that is now working for the Department of Veterans Affairs. And here's what he said: I'm not going to sacrifice my health for a paycheck. It's no longer worth it to me. I found that it was more of an experience and being micromanaged. And that's a lot of what's going on. And really not being able to do what I wanted to do in terms of life, helping vets effectively, he said. You're trained to do a certain job, to provide help in the moment. We get that. Crisis response, but it's kind of like a team effort. And if you don't have other people throughout the VA that share that same motivation for us as I do or you do, it becomes very difficult to try to connect these vets and us, me and you, to resources. The employee said he's looking for a new job in the private sector. There's more opportunities. I feel like there's more money, at least in my career, to be made there, he said. The employee said he hasn't heard back yet from the VA about his DRP request, but said it doesn't make sense for the VA to retain employees who no longer feel motivated at their jobs. Exactly. If we need help, I want people who are motivated to help me. Just as we are motivated vets to help each other, and as we should be, we want people when we go, because we raised our right hand, that care. And this is the problem with these 80,000 plus jobs being slashed. It's creating burnout. And I said that in an earlier video. And because of that burnout, somebody's got to do that work and people are quitting. From a leadership perspective, I want to chime in here. If you already have people that are 1 foot out the door, if you really want to have a workforce VA that is really veteran centric and you want to make it more efficient, let these people walk, right? I don't see a reason for people to be there saying that they don't want to be there. Okay. A longtime VA employee, the VCL employee, said serving other veterans was his main motivator for staying on the job, right? But he said he feels a federal career no longer offers the stability that it used to. What he said is, I feel that a lot of people take these government jobs because of the protections that they're afforded, the possibility of a pension, your job's relatively protected up until recently, he said. We have significantly reduced productivity, trying to make sure that we do not get fired. Hear that. Productivity has been compromised, trying to make sure that we do not get fired. Here's what a VHA manager said. They told the Federal News Network that he voted for President Donald Trump in the 2024 election based in part on how the VA ran under the first Trump administration. But the VHA manager, who is a combat veteran, said the administration's focus on government efficiency is making his team less productive. He said he applied for deferred resignation and encouraged his team to do the same. I signed up for DRP and have every intention of leaving, is what one worker said, but I'm not retirement eligible and have a family to support, so I can't leave until I have something else lined up, which as of now, I don't. He said, many of us are in this boat. We want to leave this toxic culture, but the job market is flooded. The VHA manager said his decision to vote for Trump last year was motivated by actions under the first Trump administration that made it easier to fire VA employees accused of poor performance or misconduct. That was the best time, this supervisor said, as a VA supervisor, because we had the VA Accountability Act. The VA manager said we were able to make some really significant improvements and change the culture by getting rid of people that were dragging everybody else down. The VHA manager said employees who accepted the DRP offer were the highest performers at the agency and will have the easiest time finding a job offer in the private sector. They were the employees who were here because they were dedicated, because they were constantly getting job offers to go other places, the employees said. The VA manager also said that productivity for his team has gone down because employees are spending more time on completing check-in tasks like completing weekly 5 bullet point emails. Officials from the Department of Government Efficiency, he added, have also pushed for greater surveillance and scrutiny of employee activities. Something you should take 5 minutes is now taking hours because of the fear and panic it's created for folks. I've seen productivity really just plummet because people are terrified. They go into fight or flight, and all of a sudden they're not free to just do what they know is the right thing to do, he said, because why? They're worried about their jobs, and they are on the chopping block. As a leader, the entire goal right now is what one supervisor said is to help my team not get fired. We could be doing 50 things right now, but instead we're only doing 20. And so we have significantly reduced productivity and reduced value add based on trying to make sure that we don't get fired. Man, I hate to hear that for the Department of Veterans Affairs, that people are actually going through that while we're having our claims and stuff adjudicated, while we are still needing the help that we need. Because at the end of the day, through all of this crap, what ends up happening is the veteran ends up losing out. The veteran is in the middle of all of it. And you and I, guys, as veterans, we raise our right hand. And why should we be the ones that have to suffer? You know, we should be getting the care that we need. I shouldn't have to go into an appointment and feel that it's taken me 10 or 15 minutes to get everything out, but I ain't been seen for 6 months, you know? And God forbid if you get sick like I did last year and you have to miss an appointment and then you have to switch primary care doctors and it takes 7 months to get you into that primary care doctor and they don't have anything for the foreseeable future. You know, this is a ripple effect. There's also a lot of mistakes going on as well because the VA is heavily reliant on AI, but there is a human element to the whole claims process. So if you guys start seeing a lot of errors on your claims, that's why, because of artificial intelligence. It does a great job and it gets a lot of stuff right. That some of the claim times is quicker for sure, right? But then there's also, we aren't talking about the whole truth. There's veterans on the other hand who are having bogus, crazy decisions when they've submitted all their evidence. I've seen it, right? And they should have gotten their rating, but now they got to wait another few months to appeal it because the job was not done right. All the facts and all the evidence that was presented on a fully developed claim was not considered, right? Because less people, more reliance on AI. There is still needing to be a human element to this thing to discern and decipher through. Each individual veteran's case is different and it is unique. And each and every veteran deserves to get the time allotted for their claim, for their health care, for the benefits, because they raised their right hand. So, man, we're going to keep you guys up to date on what's going on within the VA, with the healthcare, with everything. People are leaving. People are tired of it. They're burnt out. And I just said that in an earlier video that people are leaving. They're tired. They're done with it. They're done with being burnt out. They're done with dealing with so many cases. It's only a little bit of time because as a human, we're not a machine. Okay, maybe some people are, but I tell you, the majority are not. And especially veterans that are working in those positions as well, it can become very easy to get burnout. And a lot of veterans transitioning from military to civilian life and that are working in these roles as well too. You know, it needs to be a crawl, walk, run, because I know we're used to go, 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 but also we have to keep in mind that there's a transition period from military to civilian life for veterans, and it ends up harming veterans a lot of times. It causes some trouble. Some vets feel disconnected. Everybody's case is different, you know. So I just want to say it's very, very important to the VA that they keep the right workers in place and that they keep people hired and that they train more people to get these jobs done efficiently and effectively as well. And Roy just reached out here. What's up, Roy? I hope you're doing well. Hope they don't need up my supplemental. Yeah, brother, you should be good. I really hope not. If not, remember, if you file a supplemental claim, then you can come back and you can higher level review it if they do. And that's where a senior level adjudicator needs to look at your stuff, Roy. So thanks for reaching out. If anyone has any questions, hit them up in the live stream here. I will answer them. If there's anything somebody wants to know, just let me know, you know. And thanks, brother. You're gold as well, too. Thank you for your service to our country. Every one of you, happy Memorial Day. Let's go. All of y'all who serve, man, give a hoorah. Thank you for your service to our country. Army, Navy, Marines, Coast Guard, anyone, anyone who served, man. Come on, let's go. Let's go. Let's go. Thank you for your service to our country, man. It is a privilege and an honor. And we guys got to lock arms and we got to come together and we got to be together and we got to be the voice for one another. We got to lock arms, man, and keep on going and moving forward. Roy, honored to help you, brother. And if anyone does need help, just reach out, man. We are here and we are here to help vets. We are here to help vets. That's what we're here for and to do. It sucks that we just have to take matters into our own hands. We should be able to rely on the services that are available at the government levels, but unfortunately, that's not happening. If it's not one thing, it's another, which sucks. And I can't stand that. But y'all stay in the fight, stay going, keep rocking. Do not give up on your claim. Find out what's going on. If you can secondary something, maybe there's other things that you can do. If you need help, get help. But no matter what, do not give up, man. And you, my friends, if you're listening, you're worth it. You're worth it. You're worth it. Do not give up. I had a buddy last week that was struggling, man, and going through it. And it sucks to see people having to go through that. But stay there, man. Stay in the fight. Jay, what's up, Jay? How you doing? Um, Come on, brother. You're at 92%, man. You're right there. If you need anything, let us know, dude. But I'm sure you know, dude, if you're already at 92%, do what you got to do to get over the top. If you do need help, reach out. If you need a Nexus, a DBQ, if you need the secondary something, if there's something you can't do on your own, we are here to put you in the best position to wave that checkered flag, brother, to wave that checkered flag. So come on, come on, come on. Cornell, over 2 years, man, or I don't know if you did a BVA appeal or whatnot, brother, but stay in the fight. I don't know what you exactly have going on, but do not give up, my brother. Do not give up, man. And thank you, Jay, my brother Roy. What's up, man? That's my brother from California, dude. Stay in the fight. Roy can tell you his experience of continuing to push and move forward. Cornell, 2 years. Do you still have an active appeal, Cornell? Do you still have an active appeal going right now? Is it in a higher level review just sitting there? Are you doing something about it? Oh, you keep submitting supplementals. Gotcha, brother. Do you have the right evidence, though? Do you have the right evidence? Do you got the right evidence? Are you submitting the proper nexus letters? Or are you trying to do it all on your own? Are you giving them all the evidence that they need? The real reason is, why are they denying it? Man, if you're giving it to them, they gotta doggone approve it. They gotta approve it, brother. If you're giving them all the correct evidence, they got to approve it. They got to approve it. And also, if they keep denying something, maybe there's another angle that you may need to go at too, is going to be my advice as well. I don't know what you have going on. I'm speaking blindly here, but brother, keep in the fight. If you do need help, reach out. Reach out. We are here for you. info@veteransclaimservice.com. And dang, man, I'm sorry that you've gone through that and had 2 different toes cut. Geez, that stinks, brother. But reach out if you do need help, man. Maybe you can fight from a different angle, or maybe you're going to keep on fighting that. But man, always, I'm going to tell everybody, whatever you can do, go the least path resistant with your claim. Go the least path resistant, and everybody should be fighting to try to get to 100%. Honestly, ethically, integrally, try to get to 100%, because the benefits for you and your family are amazing, and you guys deserve it. So, Cornell, sorry to hear about your issues, man, with that stuff going on. But if you do need anything, reach out. But man, you guys stay in the fight. It stinks that more workers are quitting, but you can't be ran like a machine, right? And people are going to get burnout. I'm going to say it over and over and over again. They need to bring on more people. They need to see the workload, and they need to bring on and train more people efficiently and effectively and stuff. And yes, rely on AI and all that. However, a lot of stuff is getting jacked up still. A lot of people are still getting screwed up decision letters and things that, and evidence is not being considered and stuff like that, because people are just rushing through the work, checking stuff off, getting stuff off the desk, and going to the next vet. Okay. Jay, stay in the fight, my brother. Stay in the fight. Dude, you got this. And thank you guys for tuning in today, man. Happy Memorial Day to every single one of you guys. Lots of videos, lots of stuff coming. If you guys have any questions or if you want me to talk about something specific, let me know and I will absolutely do it. Thank you for your service. Stay in the fight. Keep going, man. One love. Let's go.